Here's one major way you can help your clients in perimenopause from a movement and rehab perspective. First, we have to understand the basics of fascia. First, this is a oversimplification of what fascia is, but bear with me. So we've got our skin, which then connects to the retinaculum cutis here, which then connects to the superficial fascia. Now this is super important because you can see there's fat cells here as well, but the lymphatic system flows, a majority of it flows through this layer. Now you've got your deep fascia here and then the retinaculum cutis at this angle. That's important because when we affect that deeper layer, it's going to be more of a gliding motion versus this top layer, you're going to do more cupping, gua sha, skin rolling, things like that. Now this is important in perimenopause because when estrogen declines, fascia becomes more like type 1 collagen, which is a thicker collagen, so it doesn't move as freely, which can potentially restrict the lymphatic system. So now that you know some of the basics of this, we can target more areas that are more likely to be congested because simply that's where we bend most. So like our elbows, the axilla, the underarms, behind the knee, in the inguinal area, so the groin, and a lot of times you can also do up here above the collarbone, which is where a majority of our lymphatic flow returns to, especially 80% is on that left side. So if we can improve mobility in these areas through gua sha, cupping, skin rolling, you might be able to help them feel a lot better.